Welcome to the Physician Pharmacist podcast, a show designed to shed some light on a very unusual pathway into medicine. I'm your host, Nathan Gartland. I'm a licensed pharmacist and third-year medical student. I'm also the author of PharmD to MD and the owner of the Physician Pharmacist Company. As you know, this podcast primarily focuses on the medical school journey, but today we're taking a brief hiatus away from medicine to talk about pharmacy residencies. I believe there are many parallels between the medical school application process and the residency application process, and I hope to explore some of these concepts with our special guest, Dr. Daniel Skoloda. Dr. Skoloda is a licensed pharmacist who graduated from Duquesne University School of Pharmacy in 2021. He continued his postdoctoral journey by completing a PGY2 pharmacy residency at the Johns Hopkins Hospital. He elected to continue his training at the Johns Hopkins Hospital by signing on for a PGY2 oncology pharmacy residency, where he currently serves approximately halfway through of his tenure there. Welcome to the show, Dr. Dan Skoloda.
Hey, Dr. Gartland, thanks for having me. It's a pleasure to be on. I think this is a great idea for you to have, a pharmacy resident on to kind of talk about that process for, people who may still be deciding or have some questions yet to be answered. So happy to be here.
Exactly. And kind of what we were talking about in the pre-minutes of this episode. I always push for medicine, but I think it's also good to hear from the alternative side for people who, were thinking about medicine, but then sided with the residency option. So I'm hoping to explore a lot of that today with you.
Definitely.
So let's take things way back. What initially got you started in pharmacy in the first place?
Yeah, that's a good question. I think for me, in way back in high school, I took a advanced chemistry course my junior year. It was a through like an AP course through the college that was near my high school, and I did well in it, and I enjoyed the content area, and I knew like peripherally that I wanted to do something healthcare related, kind of just being a little altruistic, to be honest. And I did explore some options, dentistry, thought about medical school for a little bit in high school, and then later on in pharmacy school. I'm sure we'll talk about a little bit later on, but I ended up shadowing somebody that my grandma had known in a small independent pharmacy in Youngstown, Ohio, and I really enjoyed it at the time. So that was kind of the path I started pursuing. And then when it was time to do college visits, I was looking at colleges with schools of pharmacy, and kind of just got sold into the program. Just because it made a lot of sense logistically. A lot of schools have 0 to 6 programs, especially the ones that were in the area that I was looking. So it made a lot of sense to do. And then, that was kind of what first got my foot in the door. And then through undergrad, taking the, more chemistry classes, OChem, and, preparing for pharmacy, talking to people in the professional phase, that kind of confirmed my decision that, I wanted to continue down this path and pursue medicine in the form of pharmacy.
That's awesome. And to clarify, so you did 2 years of undergrad and then 4 years of graduate school. So you did like the 2+4 program, correct? For the listeners? Okay, awesome. And so I guess when you entered pharmacy school, what kind of path were you thinking you were going to take? Were you thinking community pharmacy? Did you know off the bat that you wanted to do a pharmacy residency, or were you just kind of leaving things open?
Yeah, I think this is challenging probably for everybody, because when you're young, just out of high school and entering the field of pharmacy, you don't really know what is out there, which was true for me. I was at the time working at in a community pharmacy in a grocery store, and I enjoyed it. I was good at the job, and I enjoyed the face-to-face interactions with people and helping patients, in real time, having that, one-on-one contact with them. And I liked it a lot. And then as I got into the professional phase of pharmacy school, I had a really unique internship experience in a home infusion pharmacy, where we did, a lot of IV compounding, and also on the clinical side of things, a lot of patient outreach, seeing how patients were doing with their infusions, whether it was antibiotics or TPNs or chemotherapy. And I enjoyed that as well. And there was like a small clinical aspect that I got to participate in as an intern, and kind of would go to my mentors at my internship and be like, hey, can I help out with this or do a little bit more? And that was kind of my first introduction, early on in pharmacy school to what that clinical work looks like. And then as we went through our curriculum at Duquesne, you start to see a lot more of what a clinical pharmacist can offer, and you get to your rotation experiences, and you're in the hospital with clinical pharmacists. and you start to see the impact that they have. So I think as I progressed through, I didn't know necessarily at the beginning that I wanted to do hospital work, mostly because I didn't really know what was out there. But as I went through the curriculum, I saw the impact that a pharmacist can have, rounding with a team and what that looked like. And I think it was probably my third year that I was pretty sure that I wanted to do that kind of work. And to do that, usually you have to pursue some sort of residency training. So it was at that point that I kind of started preparing for that path.
That's awesome. And I think that's how a lot of people kind of get into that residency mindset is they kind of work in a hospital setting that plants the seeds. And it's nice that you had that early on because it kind of gave you almost like a head start. Obviously, a lot of people have to start thinking about it during third year, but you kind of already had those crops planted and you were
Yeah.
kind of growing on that. So that's awesome. And so obviously, and then API rotations kind of, advance that belief and kind
Mhm.
of establish that like, this definitely is something I want to do. At what point did you think about medical school then? I know that you were kind of playing around with that option.
Yeah. It was, I think, my P2 year, so the second professional year. So this was, just as I was discovering clinical pharmacy. Um, I was my roommate and I at the time, who was one of my best friends from high school and also a pharmacy student as well. We were sitting there studying for an exam, and we were, just kind of thinking about that we were doing well in pharmacy school. Like we were challenged, but doing well. And we kind of thought, well, maybe medical school is something we should consider, just because it seems like the next logical step. And like I was telling you in the pre-meeting notes, one of my friends from high school, his dad was uh, involved with admissions at a school of medicine, and we had called him up on the phone and started talking about when exactly we would be able to get into medical school, what that would look like, what the curriculum looks like, um, and what that application process is like. And we did seriously consider it for I don't know, maybe a good week or so, and then it turned out that the money wouldn't work, and we would have to finish pharmacy school and then go on to do that, where it would have been a little bit more desirable to even just leave pharmacy school at the time and go right into medical school, and maybe might have cut out a year. And perhaps if I had listened to your episode with the financial pharmacist, his name is Tim Albrecht, that would have changed my decision. But it just when we weighed the pros and cons of what we could do as a pharmacist versus the kind of barrier to entry to get into medical school, that was kind of what dissuaded us from doing that, and to pursue more clinical routes in pharmacy, because you're doing ultimately very similar things, just with a different lens, as a clinical pharmacist in a hospital setting.
Yeah, I love that. I think with a lot of pharmacy individuals, they don't really realize that, going to medical school is even a potential option. And I think
Yeah.
that's what leads to some of the regret maybe down in the future, where they think to themselves like, wow, that's something I never knew about, but it's too late for me to consider.
Yeah.
And just having that exposure, you saw it and you were like, nope, no way. Like this isn't the right path for me.
Mhm.
Pharmacy is where my heart kind of lies, and that's totally fine. And
Mhm.
I think because you had that option to kind of cross off the medical school journey or just other journeys in general, I think that's great because I think a
Mhm.
lot of pharmacy schools kind of funnel you down one pathway. They
Yeah.
say like, oh, you're going to be a community pharmacist, or oh, like maybe you should consider residency if you're qualified.
Mhm.
You're doing really well in school and whatnot.
Yeah.
And they don't really give all the other, extraneous details of maybe you could be a nuclear pharmacist or you could be, a medical school. You could go to medical school or even get your law degree afterwards.
Yeah,
So
absolutely.
yeah, I think that's great that you were able to have that experience and then cross it off the list.
Yeah, definitely. And it's not to say that I wouldn't have enjoyed that as a career path as well. There's just so many potential options in pharmacy that I was like, let me just maximize this that I have, rather than
Absolutely. If
doing
it's
something
not
else.
broke, why, why try to
Exactly.
fix it? So very good. So obviously you got into residency. So for a lot of our listeners today, let's talk a little bit more about the residency application process, because there are a lot of parallels between what makes for a qualified residency applicant as it does for a qualified medical school applicant. So do you mind telling us a little bit more about once you kind of settled on pharmacy residencies, what did you really need to do to make sure that you would get into the program of your dreams?
Yeah, that's a great question, because I think no matter what program you're trying to get into, whether that's pharmacy residency or medical residency, your process is going to look largely the same. the boxes that you need to check, I would imagine, are largely the same. And you could speak maybe more to getting into the medical school side of things than I can. But for me, the biggest things with differentiating yourself from your peers is threefold. The first, do well academically, but that is by no means a be all end all. And for a lot of programs, that is just kind of like something they look at peripherally for their candidates. So I listed that first, and I don't want to give the impression that that's the most important, because it's absolutely not. But if you are doing okay academically, that's a good start, and usually allows you to be more flexible on the other things that you're doing. Those other things that you need to do are professional involvement, whether that is with local organizations at your school of pharmacy, or regionally or nationally. Obviously, the higher you go, the better that looks for you as a candidate. But if you can get involved with organizations, especially in the leadership capacity, that will be incredibly beneficial for you as a candidate, especially for residency. And I'm sure medical schools will look at that as well. And then the last would be getting involved in research in some capacity. For me, I wish I would have, if I could go back and do it again, I would have gotten involved with research earlier on in my pharmacy school career, and had a maybe a little bit more lab experience, which I'm sure having lab experience would help you a ton for medical schools. But for me, what I did was actually took an API rotation, so a 6th-year rotation, doing strictly doing research. So it was a 5-week experience that we did. We actually ended up doing a systematic review and did the whole thing in 5 weeks, and ended up getting it published, which was really nice. So if you have research experience and are able to get it published, that's going to look really well for you as well. So I think those 3 things, if you could, if you're early on in pharmacy school and you're thinking, what should I do to differentiate myself? Those are kind of the big 3 boxes to check, and start thinking about and how exactly you want to get involved in those things.
That's awesome. Yeah, I definitely agree with a lot of those points right there. Academic proficiency is pretty much an expectation at this point. It's one of those things like, oh, you did well in school, so did everyone else you're sitting here at this interview with.
Yeah.
So, that's kind of like the bottom barrel. Obviously, it's important, and it's not a total disqualifier, because, there's a holistic review that occurs.
Exactly.
But it's definitely one of the main foundation points for an application. And correct me if I'm wrong. And then additionally, like you said, the professional organizations, being involved in your community, being involved in, advancing the profession is super, super important for, healthcare in general. So that's something that they also appreciate in medical school applications. And then obviously research is just kind of a no-brainer. Like, everyone is kind of expected to get some research under their belt, get some exposure to that side of science, and kind of translating that from, bench work, experimental research to clinical research, I think, is also important to have.
Yeah.
And you recommended obviously starting early for a lot of students. So I would recommend, basically PY 1 year, survive the first semester,
Yeah.
Good
advice.
Exactly. Make sure you're handling the new graduate level responsibilities. But after that, maybe start looking around, fishing around for some research preceptors. And if you can't find anything super concrete at that point, I'd recommend you apply for a summer research program for that following summer. You might have, API rotation, or excuse me, IPI rotations during that time period, but I definitely recommend you kind of squeeze that in at some point, just because that can really serve as a launch pad to get a lot of research by basically getting established in a research, facility for 10 weeks. You're kind of guaranteed to get some really good exposure. And it's amazing that you guys were able to publish in 5 weeks. I remember that rotation. They offered it at Duquesne, but I foolishly did not sign up for it.
It was a whirlwind of an experience, but a really good experience. And I'm honestly very proud of the paper we got out of it. It was wonderful. The one other thing too, I'll say that was really beneficial for me, and I think it will probably resonate more with the audience members who want to go into pharmacy residency rather than medical school. Although maybe this could apply as well as. But when you're looking at programs and you're going through the mid-year process for the people who are interested in pharmacy, and starting to think about where you want to be, what was really beneficial for me was going to, not mid-year was great, don't get me wrong, mid-year was a great experience, and you got to see a lot of programs and figure out what your fit in that place was, but going to regional conferences. So for me, it was the Maryland Society of Health System Pharmacy conference. it's a much more intimate setting where you can actually have one-on-one time, or one on a few time with program directors and preceptors and other residents in the area. And doing that allows them to see your name and know your face and have a conversation with you before the actual interview. So once you are interviewing with them, if you are lucky enough to get an interview, it's, hey, nice to see you again, not, hey, nice to meet you. And you could really just spring into a larger conversation, a more in-depth conversation during your interview that maybe you wouldn't have otherwise been able to do.
That's a great point right there. Like going to one of these smaller conferences, like you said, where it might be one-on-one,
Yeah,
and then showing up to mid-year later on and saying like, oh, they can pick your face out of a massive crowd of people that's hoarding around them. So,
exactly.
and
Exactly.
obviously at interviews too. So I think that's such good information right there.
Exactly.
And we're talking about residency applications at this point. So do you mind just kind of walking me through the cycle, like the application cycle? I'm not as familiar myself since I've been displaced for some time now, but yeah, can you tell us a little bit about it and help, maybe shed some light on
Yeah.
what it's like for some of our listeners?
Yeah, honestly, it's been about a year, about 2 years now since I've been applying, so I might be a little rusty, but the process is generally I would imagine it's similar to how it is with med schools, maybe just a little bit smaller. But basically, when you're applying to pharmacy residencies, you'll use what is called Forecast. It's a website through, I think, ASHP runs it, but
Hmm.
um, you'll use that primarily for your applications, and that's where you'll submit them all. But what you need to do first is figure out where you want to go, what you're looking for in a program, and where you want to be geographically, if that's a concern for you. So once you do that, you start to get your list of programs, and then you go to conferences and you go to mid-year, and you're determining not only if that program is right for you, but if you were right for the program, or maybe vice versa there. But um, it's very much a two-way street, and that goes through the process as well. So once you have identified where you want to go, you will start putting in your application materials into Forecast and ranking your programs as you would want them to be ranked. And that's very
Hmm.
much what it is. That ranking is very, very important, because not only are you ranking them, but they are also ranking you. And then the algorithm, runs and places you where the area of best fit is, essentially. And it does indeed favor the candidate. So it favors us as the pharmacy students, and takes our pick first. But you will essentially get, the match algorithm will run, and that's where you'll be placed. So um, you'll rank all of those in Forecast, and the algorithm will eventually run and put you where you are to go. But I was going to go somewhere, but I forget what I was going to say. But that's essentially the process. Usually programs will require three-ish things: your CV, letters of rec, and oh gosh,
Maybe like a mission
oh, and
statement.
yeah, letter of intent. Thank you.
Hmm.
Um,
Wow.
but those are the things that you'll need to put into Forecast, and then you rank, and then you interview, and then you rank, I guess.
That's great. And so how many programs, I guess, do you recommend applicants apply to?
It depends. There's definitely a strategy and a science to it. For me, I applied. Well, I requested. Applied to 10 programs and got 9 interviews, which I think was a
Yeah, that sounds like
pretty good ratio.
unprecedented.
Um, so I was very fortunate in that. But I think anywhere between the 7 to 12 to 15 range is reasonable. The one thing though is, if you expect it, you're happy with your CV and you expect to get a lot of interviews, I honestly wouldn't apply to more than 8 to 10, because if you get all of those interviews, you are going to be exhausted after all of those.
All the
Because you're going
travel and
through
stuff.
all the travel, you're doing appies at the same time, and the interviews are taxing, because a lot of them are long, 4 to 8 hours. So it's you know be smart about it. And the other thing too with the application process is, um, it could be helpful to apply to programs of varying prestige, I'll say, um, to kind of have some gold programs in mind, have some top tier programs that you'd want to interview at, and then maybe some smaller programs that you might be a little bit more you know you would maybe be more likely to match at, and then even some smaller programs if you wanted just like a catch all. I'll probably get this if nothing else. Kind of being smart about
Hmm.
how you apply, because I had a friend who was a great candidate, um, a really great candidate, super smart, but applied to programs all on the West Coast, which during my year it was COVID, so there was a lot more applications going out to the West Coast because a lot of people just wanted to go there, and it was accessible to them because they didn't have to travel. So he applied to programs that just had hundreds and hundreds of applicants applying to them, and it was, you know, really by no fault of his own that he only got one interview and then ended up not matching, just because the candidate pool where he was applying was vast and strong, and you know, he was a strong candidate as well, but you know, his application just got lost in the shuffle. So the larger programs, large academic medical centers, they're going to get hundreds of applicants, and it could be by no fault of your own that you don't end up getting an interview. It's just kind of the luck of the draw sometimes.
Yeah.
So there's definitely a science to ensuring that you get a residency, and just being smart about where and how you're applying. But again, don't apply somewhere if you don't think you're a good fit for them, or they're not a good fit for you.
A lot of golden nuggets right there. I definitely agree with you. A bad application list, it can sink an applicant far faster than any kind of, poor academic performance or something along those lines. You can really screw yourself over by picking too many, reach programs, like you mentioned. Like the terminology we use for medicine, we use like our safety programs, we use our target programs, then we have our reach programs. So similar thing, similar concepts. It's all just the terminology changes slightly.
No, that's great.
But yeah, and I think it's super interesting too to note. And I don't know if this is the most recent statistic, but I remember back in the day that pharmacy residency applications, I guess like applicants had about a 60 to 66% chance of getting a residency program, which is actually far lower than medical school graduates. So I thought that was super interesting. So technically, based off of a pure metric standpoint, it's technically harder to get in to pharmacy residency than it is to get into medical school residency. Granted, it might not be your program of choice, but it's just it's interesting to think about. And I don't know if that's the most recent numbers or not, but I can imagine it's probably gotten even more complicated and harder to get in.
That's a fascinating statistic. Interesting.
Yeah. So I think like MD applicants have like a 94% chance of matching into a residency. And then osteopathic, I think it's about 92, 91, 92%. So just for the listeners. But anyways, so we kind of talked about the number of programs you should apply to, and obviously apply to smartly, and don't apply to programs you don't want to end up at, because that's the worst case scenario. You do match, but then you're stuck across the country, away from family and friends, and residency is hard, as we're kind of going to get into in a minute. But
and it's true that you may interview somewhere that might look good on a piece of paper, and then you have the interview and you just don't get along with the preceptors, or the interview just doesn't go well. And it is totally acceptable to not rank a program, when you go to your rank list. I think that was something that I did mistakenly, as I ranked a program that I knew I wouldn't have been happy at. And fortunately, I didn't end up there, but it was possible that I could have, and I would not have been happy. And if you're not happy at your residency, you're just not going to do well. It's not going to be good for you. It's not going to be a good year.
You're not going to flourish in that environment, especially if you're met with constant, I guess, barriers and difficult preceptors. So that's a good segue right there. For applicants who are preparing for like residency interviews, what are some things that you would recommend? Obviously, like getting to know the program, but is there any extra tidbits you'd like to explore? Like what should students look for in residency programs when they're applying?
Yeah,
and what should they ask?
So, sorry, was the question preparing for interviews, or what should you be looking for? Because I think those are two different questions.
Yeah, we can unpack both if you want. We can do one at a time, whatever's easier. Sorry, this is a long question.
You're good. Yeah, those are both two very dense questions. So I just want to make sure we're going down the right path. I think first I'll start with what you should look for in a program, and I think that is definitely highly variable depending on your program. But some maybe across the board things that I think are important one is geography. I think it's kind of the layup. And if you're someone who is not, limited by geography, great. If you're willing to travel, that is awesome. For me, I was, and that was fine. And I just had to be smart about the programs that I was applying to in a particular area. But if you're really, don't go somewhere that you're not going to be happy in, just because, like we said, you won't flourish in that area. And that goes for not only the hospital system and the preceptors, but also the geographical location. If you're from Southern California your whole life and you want to go to Wisconsin for some reason, just think about the snow for a second before you go. Um, but all jokes aside, that's one thing, and I think is maybe a minor thing for a lot of people. Um, but other things that are important are, again, what the program can offer you. So what are your interests? And maybe you don't know as a pharmacy student, but if you have a couple in mind, that is really, really important to identify first before looking at programs. So for me, I was interested in oncology and critical care at the time of applying for residencies, and I really only applied to places that could offer me a good experience in both of those things. Hopkins having, five, six, maybe seven ICUs if you include pediatrics, and numerous inpatient and outpatient oncology experiences. It was, really a good fit for me in that perspective. And also something that's good to look at is if programs offer early commitment to PGY2 programs. If you know you want to do a PGY2 early on, it could be really, really beneficial to be in a program that offers that. Because if your first year goes well and you're doing great with the preceptors and you know that you want to stay there for a second year, it makes the process so much easier to go through an early commitment process rather than going through the match again for a PGY2. So that's something that's really important. Other things to think about and ask residency programs that might not be on the forefront of your mind when you're looking at programs, but will be very real for you when you get into residency is what the on-call program is like. Hopkins has an on-call program. Most larger health systems will, and it could look very different. Some places still do 24-hour call for pharmacy residents, others don't. Hopkins does it, and that I didn't really apply to any places that did do 24-hour call.
Avoid 24-hour call.
Some people like it. I actually have some colleagues who came from other institutions, PGY2 colleagues now that had it, and they didn't mind it at all, and they thought it was a good learning experience.
Good for them.
So some people, it could be good and beneficial, but honestly, Hopkins on-call program I think is incredibly beneficial. We essentially, 13 to 14 times a year, we will cover the code pager pretty much for an evening shift. So last year for my PGY1, it was 4 to 11 p.m. Now it's 4 to 10 p.m. They changed it this year based on resident feedback, which was great.
Nice.
But we are covering the code pager for the whole hospital, so we're responding all codes and also traumas and medicals that come into the emergency department. And for me, that's been an incredibly rewarding experience. I've gotten to see a lot of really cool things and have built a lot of poise under those high pressure situations, which is something that I wouldn't trade for anything. It was a really beneficial thing. So that's something that I enjoy. And truthfully, I didn't know that we really had that before matching to the program. It wasn't something that I was really thinking about. So that's something important. And then also what the staffing component of a residency program looks like. Some places on-call program would just be like an evening a week staffing, which is fine, and that's a good experience in the pharmacy. Some places do working every other weekend. Some places do every third, every fourth. Some places offer comp days, others don't. If you are going to a residency program that is every other weekend for staffing, having that comp day is really, really, really important. For me, I wouldn't consider a place that did every other weekend without a comp day, because 12 days in a row every other week is exhausting, and you kind of get fatigued mentally. And when you're fatigued mentally, you can't learn as much as you can, as well as you should be able to. So that was something that was important for me. Might not be important for all, but just something to think about what that's going to look like for you.
That's awesome. A lot of good information there. I recommend everyone rewinds that and kind of takes all those nuggets away, because like you said, there's some hidden gems with programs, or like things that you could potentially ask about maybe in a interview setting. Obviously be respectful and say, oh, you have 24, like, oh, get out of here.
Right.
But it's important to explore those things, because you do have to advocate for yourself.
Yeah. And that is by no means an extensive list. I mean, something that also is important to me was having a large residency class, which, we have 31 or 32, I can't remember the exact number now, residents between both PGY1s and PGY2s at Hopkins. So it's like kind of forced friendship on all those people, and they're all really awesome, and we hang out all the time. And it's great to have that camaraderie, and versus some places, you might be the only resident, which is also fine. That having all that one-on-one time with preceptors and getting all that focus on you is another great benefit. So it's really what you want, but there's a lot of other factors that can weigh into it as well.
Yeah, definitely having the community to kind of, I guess you could call it shared trauma with your residents, but it's just nice to have someone who kind of understands what you're going through at that particular time, who appreciates all the work that you do, or you have someone who can back you up if you need to get a day off, or need to kind of move your schedule around. So it's definitely nice to have that, I can imagine. So I guess oh yeah, go ahead.
I was gonna say, I think that do you want to unpack the second piece of that question is preparing for interviews or
Yeah, let's do that as well.
so I think the big things, and like I said this before, the preparation for interviews kind of starts before the interview process. If you can have conversations with program directors or preceptors or other residents prior to interviews at local conferences, or if you're presenting research, going to programs, poster presentations that you be interested in could be really beneficial. So if you can start that process early, that's great. The other things are is just coming with thoughtful questions, things that you obviously I'm sure everybody on this podcast has heard this before, but going into an interview, knowing the information that's on the website and avoiding asking those questions because it's going to show that you didn't prepare if you're asking those questions. Which
Yeah, that's dangerous.
that's an obvious one, but something that I feel just needs to be said. But then having thoughtful questions about what the program, if you're a person who's asking questions that the program can tell that you are trying to find what is your best fit, where you are going to fit in the most, that will go a long way. And just being personable, open, and honest with the people that you're interviewing with really just does go a long way. If you can kind of make like I don't know if this is going to come off correctly, but like an emotional connection with the people you're interviewing with, it really does resonate with people, because at the end of the day, it's a popularity contest. It's a people game. Your CV speaks for itself, and as long as you could talk to that and have an open conversation about it, you're going to do well. And then a lot of programs will require you to do some sort of presentation. So making sure to develop a well thought out presentation, practice your presentation. You don't want to stumble through it during the interview. So go through it a couple of times is really important too.
Yeah, especially all those little details, that they always talk about with, eye contact, body
Yeah.
language, that kind of stuff. Make sure
Yeah.
you practice that as well,
Yeah.
because you won't realize, oh, you're fiddling with a pencil for the entire interview. That's probably going to hurt you.
Yeah, it will. It will. It's those little things that matter, really.
Absolutely. And kind of adding on to that as well, this is more of an extension, I guess, of an early interview component, but how do you think like API rotations kind of fall in line with interviewing a program? Does that help?
Yeah.
Would you recommend people kind of, in medicine, we call these sub-Is essentially, where you're
Okay.
interviewing for a month long because you want to go to that program. How does that kind of fall in line with the helping with interviews?
Yeah, that's great. And honestly, something I should have mentioned earlier. If you can do an appy at a place you're interested in doing a residency at, that will go that will speak more than any interview you could possibly have with the program. Because like you said, it's a month-long interview with the place. They can know how you work, they can know the quality of your work before you're actually a candidate there. And that was, I think, something that was really beneficial for me is I did a rotation as an appy at Hopkins prior to matching there. And I think it was one of the driving factors that allowed me to match here. And just knowing what the interview process looks like at Hopkins, there have been at least one candidate that I could think of that they had a rotation here, and they just did extraordinarily well. And they were, keeping pace with PGY2 residents at the time that they were on rotation with, and that resonated with preceptors, and preceptors will go to bat for people that they know who will succeed at the program. So if you can have that experience and go the next step and get letters of recommendations from preceptors at that institution, if you're still interested in doing residency there, that will do so much for you as a candidate. It's really even hard to put into words how much that would do for you.
It speaks magnitudes for
It
sure.
does. It does.
So we've talked a lot of it about like your, how to get into residency and stuff. And obviously on match day, you got into Johns Hopkins, and I'm sure you were, elated to see that. Is
I
there
think I was there
anything
for like 10 minutes.
pure stress and anxiety, and then you open that letter, and then it's, wow, my whole
Instantly.
life just changed just like that.
Yep.
So I'm sure it's an incredible experience. Hopefully I look forward to that same situation.
All the confidence that you will.
But so I guess before starting residency, do you recommend anything to I guess graduates who now are in the process of starting residency? What do you recommend they do to kind of build up for some of these big opportunities? This might be their first job, it might be their first intense job experience. So is there like, do you recommend reading, boards, or just pure relaxation or something else?
That's a great question. So I think it depends where you are in your career, before getting into residency. If you're doing the traditional route of you graduate pharmacy school and then you immediately go into residency, Might look a little bit different than if you've been practicing for a year or two and then you go back to residency, which is, certainly a viable option. And I've known people who do that. But if you're doing what I did, the more traditional route and graduate pharmacy school, that month or two that you're going to have off between school and residency, the biggest thing that you can do for yourself is just get licensed before going into residency. For me, I think there were some logistical complications that I didn't actually get licensed until like the deadline of the day that my program required me to be licensed.
Stress.
And yeah, stress. And I was studying for the NAPLEX and the MPJE during while I was training at Hopkins and while I was kind of getting my feet under me and learning all of the operations and logistics of being a pharmacist, which was a little bit challenging. You do a lot better if you don't have that on your plate. And my colleagues who were licensed before residency, they were just having a lot better time in those first couple of months of residency and getting adjusted. So I think that's probably the best thing that you can do for yourself, before you start residency. But if you can take a vacation or two, or week or two vacation before starting residency, do it. Why not? You're not going to be doing a whole lot in between pharmacy school and residency other than getting licensed. So if you could do both, I would highly recommend it. Just kind of de-stress before the next year or two of your life are kind of a whirlwind.
Exactly. That's such good advice right there. Yeah, getting the boards taken care of ahead of time might be worth the sacrifice to, at the end of your API rotations, put in those hours then, because at least, you've already gotten a residency position likely at that point. So,
Yep.
that can kind of go to the wayside to some extent. Obviously still pass, but
Yeah.
you're kind of locked in at that point. So
Exactly.
don't make your residency life
Exactly.
terrible.
And the next year of your life will be spent, learning how to be a pharmacist and learning materials. So what you'll be able to, come up with by yourself in the months before residency, if you're trying to, get a head start on things, it's gonna pale in comparisons to what you learn as a resident. So there's really no need to do that prior, if that makes sense.
Yeah, please don't read like the residency manuals like book, ahead a month ahead and memorize every word. That's not going to go far.
Oh, yeah, your program will make sure that you know that by heart.
All right, I stand corrected. So all right, so you've had a whole year of residency experience thus far in your PGY1. What was that like for you, especially at Johns Hopkins?
Yeah, I think I listened to one of your episodes last night. I think it was episode 5 with the um, senior resident who was going to cardiothoracic surgery, and a lot of the things that he said, were similar to the experiences that I had. That first month, that first clinical rotation that you're on, your first day on rounds, your imposter syndrome is real. You're gonna feel out of place. You're gonna feel like you don't know anything, and it's gonna be scary, for sure. That's like I think one of the largest barriers that I'm pharmacy residents, and I'm sure medical residents go through, in your first couple of weeks and couple of months through residency. And it's scary, especially at Hopkins as an institution that values independence, I'll say, and I value independence as well. And I think that's one of the best things that a program can do for a candidate, is giving them the freedom to learn that they are an independent practitioner and they have the abilities to do that. But it's a scary thing to realize. So it's a challenging transition going from student to resident pharmacist. But especially in the post-COVID world, communication is very easy. So if you're on rounds and you have a question, a preceptor is always a Teams message away, or whatever messaging software your health system is using. So it's kind of nice to have that parachute, so to speak. But it's a challenging experience. There's on top of that, you're also getting tons and tons of projects that you have to manage and set time aside for, and it could be a little overwhelming at first. But it really does help you grow as a practitioner and grow as a leader, grow in your own project management skills and time management skills. So it's definitely a process, and the process is there to make you somewhat uncomfortable, but that's what helps you grow at the end of the day. And really what that experience felt like as the residency year went on, there was like in August of my PGY1 year, my preceptor described it as there's going to be 2 or 3 moments throughout the year that something's just going to click, and you're going to wake up the next day and you're going to feel completely different than the day prior. And that was the truest statement I've ever heard in my life. It was, for me, it was after that first rotation, I felt really good about myself. I don't know that was necessarily a click, but I felt like I was on top of things ish. And then in December of my PGY 1 year, so about a year ago today, I just kind of woke up one day halfway through the month and I was like, whoa, I have learned so much in these past 4 or 5 months of doing rotations. And I, starting to build some confidence. I actually felt like I knew what I was doing for once. And that was kind of the first moment that I was like, wow, this process really works. And it's, it was really compelling at the time and still is. And then it was later on in April that I was like, okay, I am now ready to be a PGY2. I am ready to specialize in something. I feel very comfortable with medicine. I feel incredibly comfortable, voicing my opinion, and when my opinion is met with resistance, backing up my opinion, and I'm ready to do, take the next step and become more specialized in a content area. So that the process, it really works, and there's very tangible moments throughout the year that you're going to say, wow, this is a feeling that I didn't expect, and you're going to be a different person at the end of it. And when I heard that as a person coming into residency, I was a little skeptical of it, that I would actually be a different person at the end of it, but it's really true that you will be, and you'll be a lot better for it.
Yeah, I think that's so interesting. Like you had this epiphany moment where you're like, oh my goodness, I'm still here. They haven't fired me. Like I've actually,
Yeah.
then you look back and you're like, wow, how did I even survive the first month? And oh,
Yeah.
look where I am now, where I
And
can
I'm
make
smart. It's crazy.
I can make clinical decisions on the
Yeah.
spot, like, and I can
What?
defend them. Like this is crazy with literature.
Mhm. It's
Oh,
it's a really fascinating experience, but that's kind of what it felt like for me.
oh, that's awesome. And I think too, like you said, a lot of people when they start off on this big journey, they're going to be scared. And you
Mhm.
look at to yourself and you see like the attending or like the chief pharmacist, calling the shots and
Mhm.
doing it with such like poise and
Yeah.
confidence. And you're like, that can never be me. And
Mhm.
then, you have to think to yourself, like to put things in perspective, like that
Yeah.
individual right there was
Mhm.
in my shoes at some point,
Exactly.
feeling the same thing that I'm feeling. And, they've kind of been through the crucible to get to that point. And, that's what residency is.
Mhm.
But you come out a lot stronger because of it.
Yeah, exactly.
So I'm curious to know, well, PGY1 is pretty broad in the sense that you kind of
Mhm.
travel around and do a lot of different rotations,
Yeah,
correct?
correct. And that
How
was actually advice I got from one of my mentors at the beginning of the year when I was picking rotations, was to, with the lens that I knew I wanted to do either critical care and oncology, to not do those things during my PGY 1 year outside of what was required, and maybe one or
Interesting.
two rotations in those things to solidify that that was what I wanted to do, and take rotations that would uh, support my future career path, that isn't directly related. So for me, when I knew I wanted to do oncology, I took an infectious disease rotation because our patients are immunocompromised and get crazy infections. I
Hmm.
took a pain and palliative care rotation because our patients are in pain and they need that support. So I took rotations that were strategically placed around what was going to help me succeed in a second year, that weren't necessarily exactly that. Like the advice wasn't to take 10 oncology rotations my PGY 1 year, because I was going to get that experience in a PGY 2.
Exactly. Oh, that's really good advice right there. And so they give you some, obviously you can't choose everything, but they give you some opportunity to kind of pick and choose a couple elective spots. Is that how it works?
Yeah, so that's going to change from program to program for sure. But Hopkins was actually incredibly flexible in that we actually only have, as far as your core rotations, your month to month rotations, I'll say we actually only had two requireds. We had internal medicine was required and an ICU was required. But outside
Hmm.
of that, we had the freedom to pick really whatever we wanted to do,
That's awesome.
which was great. And Hopkins has pharmacists so well embedded in pretty much every service. So we had, excuse me, opportunities to do a number of different things. Like I said, infectious disease, pain and palliative care, transplant. We have kidney transplant, liver transplant, heart transplant, lung transplant, surgery rotations, oncology rotations, ambulatory oncology rotations, pediatric rotations. I mean, we have had uh, pretty much a pick of anything that we wanted to, any specialty we wanted to see. We had the opportunity to do it. Um, that was one benefit of a large academic medical center setting, and that's not unique to Hopkins by any means.
That's awesome. And so obviously because of that, you were able to experience a lot of different things and at the same time kind of cross off that, kind of reassure that you wanted to do oncology.
Yes.
So obviously you knew that you wanted to do oncology. So it sounds like you did the early commit process.
Yes.
Okay. I'm not sure if you'll be able to comment too much on it, but how, do you know anything about like a PGY2 application and what that's like? If you
Yeah.
weren't to do early commit, and maybe you can talk a little bit more about early commit.
Yeah, I think so. For the PGY2 application process, if you're at a place that doesn't have early commitment, it's largely the same as your PGY1 application process. So I think most people will be relatively familiar with it, with one notable difference, maybe two considerations to make before committing to a PGY2 or interviewing for PGY2 positions. The first is that if you are at a place that gives you flexibility in your rotation schedule, try to do at least one, maybe two, if you're applying externally, rotations in areas that you want to pursue. So if you want to do critical care, it would be beneficial for you to have a one or two critical care rotations, or maybe even critical care and emergency medicine rotation prior to that interview process, just so that you have something to speak on when you get to interviews, interventions that you've made, patients that you've seen, stuff like that. Just make sure you have that experience under your belt so that you could go to a program and say, I am confident that I want to do this because I've had this experience, and I will do well at your program because I have had this experience, so to speak. So that's the first thing. The other thing too is going through the PPS process, professional placement service process at ASHP mid-year. A lot of programs, this is again a smaller, intimate setting that you could talk to program directors and preceptors at, and get them to know your face and things that you've done and where you've come from and how your year is going and stuff like that. And even to the point where some programs won't actually even consider candidates if they didn't PPS for their program. So that's the other notable difference. But I think otherwise the process is the same. And maybe I'm missing something because I didn't actually go through that process. But that's my understanding of the two notable differences from the PGY1 interviews. But for an early commitment process, again, this might look slightly different depending on your program. But essentially, how it worked at Hopkins was we had the opportunity to formally express our interest in a program, and then from there we would interview with that program as normal. So for oncology, we had 5 separate interviews with different groups of people, ranging from the preceptors to the program directors to higher leadership within the health system. And based on those 5 interviews and a letter of intent in our CV, we would either be offered the position or not offered the position. But what is generally accepted as the correct thing to do is to take a rotation in that specialty area prior to the early commitment process. So for me, I took a medical oncology rotation, which is essentially internal medicine with an oncology spin in an inpatient setting. So I took that. That was my first rotation of residency, and I loved it. And that was what confirmed my decision to pursue oncology. And then the rest was history.
Wow. And so now you're a PGY2 oncology resident.
Correct.
Can you walk us through a little bit about, I guess, like, what does the average day look like for you? I know it's going to change with every rotation you're on,
Yeah.
But maybe you could tell us about like kind of what the expectation is each day, and maybe you could share one of the harder rotations you've had, or maybe one of the easier ones.
Yeah, that's a great question. And honestly, something that's super important, because this was not, I'm going to say something that it was not apparent to me, and I think is very beneficial for your audience to hear. PGY2 is way harder than PGY1. Don't go into PGY2 thinking it's going to be the same, because it's not. The stakes are raised and the expectations are higher. So don't do something if you're not 100% sure that you want to do it. You have to have a passion for something before you pursue a PGY2, because it is a difficult process. The stakes are for sure raised. But a typical day for oncology is unique in that there is a large ambulatory component to it as well. A lot of chemotherapy is being transitioned to the outpatient setting, and a lot of cancer treatment we're utilizing oral chemotherapy for treatment. So there's kind of it's not necessarily recent, but it is a shift that's happening at the moment, that there's less of an inpatient focus and more of an ambulatory focus. So our program at Hopkins is designed to reflect that. So it's set up about 50% inpatient and 50% outpatient. So depending on the rotation in the month, the day will look pretty different. But our first 3 rotations were inpatient, so rotating between the leukemia service, the lymphoma and BMT service, and then the medical oncology service was our first 3 rotations. And the day typically looks like how your normal inpatient rotation experience would look, is you go in the morning at whatever time you need to pre-round. You pre-round, you learn your patients, you come up with your recommendations, and then you go to rounds at a lot of our rounds started at 8:30, which was really nice. Some are earlier, some are later, depending on what specialty you want to go into, but that was what it was for us. go to rounds, participate in rounds, make your recommendations, chat with the team. Some teams do, a post rounds debrief, so to speak. And you do that, take care of all your patients, and then at some point in the afternoon, you meet up with your preceptor, talk about the recommendations that you made, or ask any questions that you have, present your patients, and then you go from there. If you have to follow up on any things in the afternoon, whether that's just extra things that you didn't get to bring up on rounds, or following up with TDM, or anything that comes up throughout the day, you get a secure chat from your team with questions, answering those questions, fielding those questions. Or if you don't have any of those things coming up, working on projects, which there are no shortage of in PGY2 year. Projects and presentations will be a large component of your PGY2. So there's sometimes in the afternoon on an inpatient rotation, you'll have time to do that. Then things will look different if you're on an ambulatory rotation. If patients don't start showing up to clinic until 9 o'clock ish, and you have the flexibility to sleep in a little bit, but you're taking care of things more throughout the day. It's kind of more sporadic, because patients will be coming into clinic at different times, or you're calling patients and coordinating their oral chemotherapy, and everybody has a different schedule, so it's maybe a little bit less regimented if you're on an ambulatory rotation, where you're just kind of coming in the morning, then dealing with the tasks as they come and as patients come into clinic. So it looks different from that perspective, and you just kind of have to be cognizant of time, your patient's time, and time management skills with managing your projects and presentations.
That's awesome. Yeah, I think that's interesting, because from outsider perspective, I would think like the hospital would be a little more chaotic than an ambulatory setting, but that seems not to be the case. I think that's super cool.
It certainly can be chaotic. On our inpatient rotations, we're required to carry the code pager for 1 week during our inpatient rotations, which if you're trying to deal with your patients, and then the code pager is going off and you're going to other patients, it could be hectic for sure. But it's often a little bit more regimented than an ambulatory rotation is, because things can happen at any point in the day in the ambulatory setting.
Awesome. And so I guess, as a PGY2 oncology resident, you've seen a bunch of things now at this point, that you're almost halfway through. What kind of specialty do you actually want to end up in, specific to oncology?
Yeah, that's a perfect question, and especially for this time of year, as we're starting to, we went through the PPS process and we're starting to apply for jobs. And my passion, my interest is heme malignancies. So leukemias and lymphomas are what I find interesting, and what I would like to do with my life. And honestly, for me, an ideal position is something that rotates between the inpatient and the ambulatory setting. Because like I said at the beginning of the discussion today, is those patient interactions are something that is valuable to me, especially in an oncology population who are so engaged in their care, because they have to be, because they're scared, and because they need that support. And that's something that we could really offer as pharmacists. So I don't ever want to lose that. So I hope to have some ambulatory experience, but I really do, my passion, I would say, is for inpatient care. So some sort of rotating inpatient, outpatient heme-onc position is my dream position at the moment, and that's what I'm pursuing as I'm applying for jobs in this next couple of weeks.
Wow, that's awesome. And I think that's interesting too, because from my experience at Hopkins, when I was there for rotations, I remember on those inpatient services for BMT, these patients are there for guaranteed 1 month, after getting all of this care, because they have to be kind of supported through the chemotherapy process. So like you said, you really, really get to know some of these patients, because you spend a whole month of their life with them. And you see them every single day. So, you go off for a day, and you come back Monday, they're like, "Where were you?"
Yeah.
You're supposed to be here.
That's so true, especially, and that's why I want an ambulatory component too, because you'll have, somebody comes in, screaming hot sick with an acute leukemia, and you fix them up in the inpatient setting, you give them chemotherapy, they stay for a month, like you said, and you get to know them, and then, you discharge them eventually. And, sometimes if you're all inpatient, you can kind of lose track of them. But if you're in the ambulatory setting, you're helping dealing with their oral oncolytics, or they're coming in for transfusions, and you can get to go see them again and really see them through the continuity of care. And then, they'll go on to get a transplant after their leukemia potentially, and you can follow them through that process. And then eventually you'll see them cured one day. So it's having both of those components could be really cool and really rewarding.
Absolutely. Absolutely. So I guess you've kind of been through, your 6 months at this point. you're definitely more comfortable with the position that you're in.
Mhm.
Do you find yourself having time to work on the outside or to like, I guess, enjoy any hobbies that you have?
Yeah, I would say, like I said, PGY2 is a lot harder than PGY1. So I think I was able to do a little bit more with my time as a PGY1 resident. But this year is something that maybe is unique to me. I actually got married at the beginning of the year. So now this year has been trying to find that balance of, you know, spending time at work and being good with my time management, getting my stuff at work done, and also building my life outside of it. And my wife and I have been, kind of working together to, you know, figure out a schedule that works for us, and just kind of plan things out and the times that we can spend together. So there's definitely an active component to it, I'll say, is of finding that balance. If you aren't smart about your time, you might not have good work life balance. But if you are smart about your time and you're willing to make some sacrifices, you can certainly do things outside of work. And then again, maybe different PGY2 programs will have different expectations, and maybe some will have more or less work life balance. But for me, something that is helpful for me is I just put everything that I'm going to do with my life on my calendar. I'm, very regimented like that, just so I could visualize it. And that has helped me understand when I'm going to do things, the time I have allotted to do things, if that's enough or not. And then using that other time to, do hobbies, whether that's, something I love to do is rock climb and cook. Those are kind of my two, main
Hmm.
hobbies. And I've certainly had times this year that I've been able to do those things, and times this year that I said, I can't actually do this week because I have to, focus on work. There's ebbs and flows in residency, and you'll see that as you get into medical residency, I'm sure, and it's true, I
Hmm.
imagine, for most pharmacy programs. So there will be times that you're saying, "Wow, I wish I could do this thing, but I have to do this work," and being disciplined enough to do that, knowing that once you finish this thing, you'll have time to do what you want to do. So I think, you know, I wouldn't expect to be able to 100% focus on a hobby if that's what you want to do if you're in a residency program. But if you're smart about your time and you're, diligent, you will have time to do those things. So it's very much an active process, but you could do it if you're efficient.
Absolutely. There's definitely some give and take. And,
Mhm.
you're at that stage where you're 6 months out. It's very tangible that you're going to have some free time in the future. So you're probably just like, I can buckle down for the next 6 months. I've already done a year and a half. No big deal.
Yeah.
But
Pretty much.
great. So we're coming to the end of the interview, and I just want to ask, one final question. So
Mhm.
obviously you're on the podcast here because you have a lot of, life experience, a lot of knowledge to help other students. How do you plan on helping others kind of continue and follow in your footsteps? Do you stay involved in the community? Do you plan on
Mhm.
going to more, conferences in the future? Something along those lines.
Yeah, that's a wonderful question. And something that I think I really have an affinity for is teaching and precepting. And something that was um, really, really beneficial for me was that rotation at Hopkins that I had mentioned that I took. Um, that rotation actually was an inpatient heme-onc rotation, and it was kind of from that experience that I knew that this was the direction that I wanted to go, and I would love to be able to offer that experience to um, students and anybody who is interested uh, in pharmacy or oncology even. So hopefully being at an institution where I have the opportunity to precept, I want that to be a large portion of my career, because I love it and I want to offer people that experience. So precepting is something that I'm actively looking for in a place of employment. If I have the opportunity to be involved in a school of pharmacy, and come in as adjunct faculty and give lectures, I would love that. If I have an opportunity to be um, involved with student organizations at schools of pharmacy, I would 100% do that, and that would be something that is high on my list in looking for um, jobs in the future, and also being involved with professional organizations. The Hematology Oncology Pharmacy Association, HOPA, is very prevalent in our program. It's something that we're involved in, and we'll eventually present our research at in a couple of months here. So being involved in those organizations is going to be, the forefront of my career once I have a position and I'm able to be established. So I'm looking to be involved in those things. But I think, like I said, offering those experiences to students, and teaching them about oncology, and showing why this is a very rewarding, very fulfilling career path, as much as I can throughout my career, is something that I'm actively looking for.
Yeah, I love that. I think it would be so great to, just like yourself, going back and teaching at, Duquesne or at one of these, pharmacy universities, or even just doing a couple guest lectures here and there.
Yeah,
I think it would just be a super rewarding process. I think it also keeps us young in the sense that we're kind of forced to stay clinically relevant.
yeah,
So I think
absolutely.
that's a great way to do that.
And it doesn't stop at pharmacy students too. I can't tell you how many medical interns that I've had discussions with about this year. Like, hey, guys, leukemia is awesome. You should do it. And they're always like, I don't know, but I'm like, guys, no, do it. Having those conversations with medical residents too is always a lot of fun too.
Geez, man, you're convincing me at this point. I have thought about it pretty extensively, but it is a long track, so we'll see
Sure,
how things turn out.
sure. And there's a lot of great stuff out there. So, do your due diligence and find what you like. But hey, leukemia is always a great thing.
Absolutely. So, all right, we've come to the end of our interview, and I'd like to take this opportunity to thank all of our listeners for the support. If you have any additional questions about the medical school journey, you can check out my website at www.physicianpharmacist.com. For more information about medical or pharmacy residencies, obviously you should reach out to Dr. Skoloda. And Dan, how can our listeners get in touch with you or learn more about you?
Yeah, I think the easiest and best way is via email. So I don't know if you want to put it in the show notes or something like that, but
Yep.
dscoloda or dscolode1 dskolod1 at jhmi.edu is a great place. If you have questions, feel free to reach out. Might not be an incredibly prompt response, but I will get back to you eventually.
Yeah, absolutely. Make sure you send him all of your residency questions. Now your email's going to blow up.
Yeah, right.
But yeah, I'll drop those in the show notes so everyone will have access to that as
Great.
well. All right. Well, thank you so much for being on the podcast, Dan. I know you're extremely busy. You have to go into work later today, and I'm fortunate enough to be on vacation, so that kind of sucks for you.
Well, thank you for having me, Dr. Gartland. This
But
was
I,
a great conversation. Enjoy the opportunity to be in here.
all right, man. I appreciate you today for coming on, and I hope you enjoy the rest of your Christmas holiday.
Thank you. You as well. And enjoy the rest of your vacation too. Soak it up while it lasts.
I know it's too short. All right, take care, man.
You too, man.